Hello, my name is Janelle Ramirez, and I will be presenting on multiple personality disorder. I was interested in this topic because it just seems fascinating and saddening that our minds will come up with several different personalities in order to cope with severely traumatic experiences. I would say this topic belongs to the category of psychological disorders, though it might be tempting to put this under the personality category. So, what do you all think MPD looks like? Maybe some movies from pop culture come to mind, such as the movie Split, Dr. Jekyll and Mr. Hyde, or Sybil. Well, let's start with the brief history. MPD was only recognized as a psychiatric diagnosis by the American Psychiatric Association in 1980 and was thought rare up until then. In 1994, multiple personality disorder was renamed dissociative identity disorder in the American Diagnostic and Statistical Manual of Mental Disorders. Though the World Health Organization still uses the same multiple personality disorder in its international classification of diseases. I will go back and forth calling it MPD or DID in this presentation to mirror the sources I have used. So, let's actually define this disorder with a definition from an article by the National Alliance on Mental Health, which is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. Formerly known as multiple personality disorder, this disorder is characterized by alternating between multiple identities. A person may feel like one or more voices are trying to take control in their head. Often these identities may have unique names, characteristics, mannerisms, and voices. People with DID will experience gaps in memory of everyday events, personal information, and trauma. Women are more likely to be diagnosed as they more frequently present with acute dissociative symptoms. Men are more likely to deny symptoms and trauma histories and commonly exhibit more violent behavior, which can lead to elevated false negative diagnoses. Next, let's talk about why people develop this disorder. It usually develops as a way of dealing with trauma. Dissociative disorders most often form in children exposed to long-term physical, sexual, or emotional abuse. Natural disasters and combat can also cause dissociative disorders. Early childhood trauma causes DID to develop by preventing the child from forming a cohesive or unified sense of self, known as a core personality during their earliest years. Instead, the prolonged trauma causes the different quote-unquote behavioral states present from birth to become increasingly dissociated from each other, and over time these develop into alternate identities. It is believed that developing multiple identities protects the child by keeping trauma memories and emotions contained with specific identities, rather than overwhelming the child completely. Let's move on to identifiable symptoms that come along with DID, listed in the DSM-5, which is the handbook used by healthcare professionals in the United States and much of the world as the authoritative guide to the diagnosis of mental disorders. The key characteristic of DID is the presence of at least two distinct personality states. The presence of recurring periods of amnesia is the next most important characteristic, with ongoing gaps in memory about everyday events, personal information, and/or past traumatic events. The remaining diagnostic criteria require symptoms to cause distress and/or impaired functioning in at least one area of life. DID can also only be diagnosed if no other condition provides a better explanation for symptoms. Potential treatment options include psychotherapies, including cognitive behavioral therapy and dialectical behavioral therapy, eye movement desensitization and reprocessing, as well as medications such as antidepressants can treat symptoms of related conditions. Now let's talk about a case study from an article called Multiple Personality Disorder, a clinical investigation of 50 cases, which has been cited around 361 times and published in the Journal of Nervous and Mental Disease in 1988. In this study, 50 patients with multiple personality disorder were assessed using clinical history, psychiatric interview, neurological examination, intelligence testing, and a variety of psychiatric rating scales. Results revealed that those with MPD were usually women who presented with depression, suicide attempts, repeated amnesic episodes, and a childhood history of trauma, particularly sexual abuse. Also common were headaches, hysterical conversion, and sexual dysfunction. Intellectual levels varied from borderline to superior. Data suggests that the cause of MPD was strongly related to childhood trauma rather than to an underlying physiological dysfunction. Here are some tables from that study that outline presenting symptoms, types of trauma reported, and characteristics of alternate personalities. There has been quite a bit of controversy around MPD. This condition is often confused with schizophrenia and other disorders as well. Movies are also known to exaggerate the extremities of this illness, such as in the movie Split. MPD has been popularized in many works of fiction throughout the world, often as a plot device to allow murderous characters to fool everyone around them. In conclusion, why is this all important to know? First, to better understand people with this condition and possibly identify the associated symptoms and get someone the help they need. Second, to break the stigma around this condition of being scary and untreatable. And to recognize people who have experienced physical and sexual abuse in childhood are at increased risk of DID.